3. Our presenter are Lisa Brown, Navneet Kaur, Dolma Chanjong, Marin Sangalang, Rama Pusari. We would like to present about Dorothy Orum's self-care deficit theory. Our outline of our presentation are introduction of Dorothy Orum, unique and major concept to Dorothy Orum's theory, fundamental assumptions of self-care deficit theory, theory and philosophy related to 21st century nursing practice, case scenario, client assessment, nursing diagnosis, client intervention, client goal, client evaluation, and conclusion.
Dorothy Orum Self-Care Deficit Theory. About Dorothy Orum. Dorothy Orum was born in 1914 in Baltimore, Maryland. She earned her nursing diploma at the Providence Hospital in Washington, D.C. She completed her Bachelor of Science in Education in 1939 and in 1945 her Master of Science in Education. She has worked as a staff nurse, a private duty nurse, a nursing educator, a nursing administrator, and a nursing consultant. It was while working in the Office of Education as a nursing consultant in 1958 that Dorothy Orum began work on her self-care theory. In 1959, she first published her theory in Guides for Developing Curricula for the Education of Practical Nurses, a government publication. And in 1976, she received an honorary doctorate of science degree. Concepts unique to Dorothy Orum theory was the fact that she believed that each person has a need for self-care in order to maintain optimal health and well-being. Dorothy Orum's self-care theory is separated into three conceptual theories: self-care, self-care agency, and nursing system. Self-care, a practice of activity that individuals initiate and perform on their own behalf in maintaining their health. Self-care agency, this is the human ability to engage in self-care. This is dependent on age, developmental state, life experience, resources, and socio-cultural orientation. The concept of self-care theory is broken into three components: universal self-care, which is associated with life processes and the maintenance of the integrity of human structure and functioning, and includes all activities of daily living. It also includes the maintenance of sufficient intake of air, water, and food, provision of care associated with elimination process, balance between activity and rest, prevention of hazards to human life well-being, and the promotion of human functioning. Secondly, the development of self-care need. This is associated with developmental process derived from an event, such as adjusting to a bodily change. And thirdly, the health deviation. This is required in condition of illness, injury, or disease, and these include seeking and securing appropriate medical assistance, being aware of and attending to the effect and result of pathological condition, effectively carrying out medically prescribed measures,
Major concepts and assumption of self-care deficit theory. Dorothy Orum's self-care deficit theory, considered as a grounded nursing theory which covers the broader concept of assisting individuals to promote their independence for life care activities and to achieve their health goals. The major concepts of Dorothy Orum's self-care deficit theory includes nursing, human, environment, health, self-care, and self-care agency. First of all, nursing, which is an art to assist individuals with disabilities to promote their independence and providing those level of help to promote their independence to perform activities so that they can attain their health goals. Then next comes to the individuals or human, that could be children, men, women, that act as a material object for nurses to seek assistance and help to guide them to attain the healthcare goals. Environment could be biological, physical, chemical components, and that includes family, community, and culture, and act as a determinant of health that impact on individuals' health. Then talking about health as a major concept could be structural and functional well-being and act as a whole for individuals that they need to maintain and to attain those goals that are needed for healthy living life and well-being. Then next comes to the self-care. Self-care could be those performance of activities that individuals have to perform throughout their life or daily basis. That includes their self-care activities performance, that they need to be independent to lead their life in a healthy and positive way. Then self-care agency includes performance of those self-care activities under the effect of some contributing factors that could be age, gender, developmental state, health status, financial status, socio-cultural context, resources availability, and the environment. Then next comes to the assumptions of self-care deficit theory. Dorothy Oram has identified 5 major ways of helping individuals that could be acting for others and doing action for others, supporting others, teaching them, guiding them, and providing that zone of environment that they can promote independence to achieve those healthcare goals. The assumptions includes every individual is a self-reliant and includes nursing, which is form of action that includes one or more people to assist and to help individuals to promote the independence. And in this assumption concept, the communication is considered as the major concept that individuals have to share their ideas, views, and concerns among each other, that they can feel that they have someone to seek assistance, guidance, and then they can lead their life in a positive way. More assumptions comes about successfully achieving those healthy living goals that includes the personal care, basic needs, and performance of activities independently, for example ostomy care, management of diabetes and blood pressure, and exercise regime. So nursing is an art to attain the functional as well as independent life of people that act as a rehabilitation phase in the primary care to help those who needs the help so that they can lead their life in independent way and they can distinct about their needs as well as attaining the goals in the health field so that they are prevented from disease, and they seek the guidance from nursing professionals that they can share, they can guide, and they can seek help from others to achieve their healthy as well as optimal health. Thank you.
Is theory or philosophy related to 21st century nursing practice. Dorothea Orum's self-care deficit theory has been proposed as a conceptual model of nursing practice because the immediate goal of conceptual model is to guide practice. Orum's theory guides nurses in the nursing process, help nurses to assess the patient condition, identify patient problems and needs of the patient and intervene accordingly. Guide nurses to identify the self-care requisite of the patient in various aspects, helpful in providing comprehensive care to the patient. Guide nurses in enhancing practical knowledge by taking appropriate nursing action specific to the patient cases. Theory of self-care deficit shows how practical knowledge can be shaped and structured. It is very useful tool to evaluate how well the method of nursing assistant and the nursing system could be used to solve the identified problems of the patient with self-care deficit, and also to evaluate the mutually set goals are met or not. As a general theory, it is useful in all levels of nursing education. It fits into any nursing situation as it provides explanation of what is common to all nursing situations, not just an explanation of an individual situation. It guides nursing practice with theoretical concept and goal setting and provides foundation upon the nurses questions the practice and expand the avenue of nursing research. Next is case scenario. Jack, 72 years old, diagnosed with type 2 diabetes and the right-sided ischemic stroke, will be soon discharged from the rehabilitation after a year. Jack, due to his illness, can no longer perform his self-care, including activities of daily living, and develops self-care deficit. He requires total assistance to perform his daily activities such as eating, grooming, bathing, dressing, and toileting. His children, who lives far away from him, wanted their father to get into long-term care facility for better quality care, but his wife, 68 years old, who is very active, does not want her husband to be in long-term care facility until she's arrived. She wanted her husband to be care at home. Healthcare professional conducted a family meetings and decided to discharge him to home with community services link. The healthcare professional services include the nurse, personal support worker, occupational therapists, and physiotherapists. Before getting discharged, nurse teaches patient and wife about how to promote his self-care and prevent complications such as preventing aspiration by sitting upright while feeding, crushing pills, and maintaining proper diet. The nurse also teaches the patient and wife about how to maintain blood glucose level at home. Next is Klein assessment. Neurological assessment assess level of consciousness, orientation, motor, pupils, speech and language, vital signs, and blood glucose level. Assess cognition function, that is reasoning and planning, motor, balance and dexterity, and perceptual, including sensory abilities. Assess the complications such as painful hemiplegia, shoulder spasticity, contracture, and deep vein thrombosis. Assess Klein risks for pressure injury developed by using reliable risk assessment tools such as Braden scale. Assess risk fall. Assess Klein pain using validated tools such as number rating scale, the verbal analog scale, and verbal rating scale. Assess for difficulty in swallowing, including Klein alertness and ability to participate. Assessment of speech, language, and voice quality. Nutritional assessment to prevent complications and malnutrition. Assess and identify patient self-care needs. Assess patient ability to perform the activities of daily living, including personal care, mobility, grooming, dressing, bathing, and toileting. Assess patient's ability to perform instrumental activities of daily living. Identify the factors affecting ADL and IADL. Assess bowel and bladder function. Assess and screen patient for evidence of depression. Assess caregiver burden. And last, assess patient and caregivers' learning needs, abilities, learning preferences, and readiness to learn. Next is nursing diagnosis. Based on the assessment data, the major nursing diagnosis for the patient may include the following. First, impaired physical mobility related to hemiparesis, loss of balance and coordination, spasticity, and brain injury. Self-care deficit, risks for impaired skin integrity related to inability to change position, impaired swallowing, disturbed thought process related to brain damage, inability to maintain the ideal nutrition related to inadequate intake and knowledge deficit about stroke and diabetes type 2 diet, interrupted family process related to catastrophic illness and caregiving burdens, acute pain related to hemiplegia and disuse of left hand and left arm. Risks for unstable blood glucose due to inadequate blood glucose monitoring and deficit knowledge of diabetes management, imbalanced nutrition less than body requirements due to inadequate intake, insulin insufficiency, and deficit knowledge of stroke and diabetes related diet, deficit knowledge, absence or deficiency of cognitive information related to diabetes type 2 and stroke related knowledge, risks for infection and increased risks for being invaded by pathogenic organism due to high blood glucose level, decreased leukocyte function, and alteration of circulation. So next we are going to discuss about nursing interventions and rationales. First is use assistive device to facilitate ambulation transfer safely in order to promote safety of the patient. Frequent neurological assessment that will alert nurse to any changes in neurology as early as possible and prevent risks and complications and intervene when needed. bed at 30 degree unless otherwise indicated, that increase venous return and decrease intracranial pressure. Initiate DVT prophylaxis, decrease risk of subsequent stroke, ensure physiotherapies, occupational therapies, and speech therapy is ordered in order to do the complete baseline assessment and provide recommendation, as rehab is essential in stroke recovery. Next is fall prevention measures in order to prevent injury and promote safety of the patient, prevent contractures, prevent aspirations, follow speech therapist recommendations, always keep upright position while feeding, and suction available all the time, assess lung sound and body temperature, cluster care, promote rest, monitor vital signs appropriately, and especially blood pressure. Monitor blood pressure is essential in managing the intracranial pressure. Elevate limbs, utilize compression stocking, promote ambulation, promote complete bladder emptying. Elevation of limb and utilize compression stocking is very important in order to prevent edema. Promote self-care. Patient will have a decreased ability to care for self due to deficit. So it is very important in the part of nurse to promote confidence and encourage and make participation in caring for themselves as much as possible. Promote cerebral tissue perfusion, facilitate safe swallowing, ensure bedside swallow screening completed and speech therapy assessment prior to oral intake, and promote adequate nutrition, prevent skin breakdown or pressure injury risks, that is to change position every 2 hourly, ensure adequate nutrition and protein intake, pillow support, keep linen clean, dry and unwrinkled. And the last one is to facilitate communications, promote family coping and communication among the healthcare team. Because having a stroke is a major life event, roles within families and support system may change, especially if the patient play a caregiving role within their family structure. In the scenario also, the families are in dilemma. The wife wants her husband to be care at home, and his children wanted him to be in long-term facilities in order to have a quality care. So it is very crucial to conduct a family meeting to facilitate communications among family and healthcare team.
Hello, my name is Rama Busuri. My presentation is about Dorothy Oram self-care deficit theory applying to a patient who is diagnosed with type 2 diabetes and right-side ischemic stroke. The theory of self-care deficit is the core of Oram's grand theory of nursing because it tells you when nursing is needed. Nursing is required when a person is incapable of or have a limited in the provision of continuous effective self-care. Oram's theory of self-care deficit takes into consideration the power or the ability of both the nurse and the patient to restore, to promote, and maintain physical and psychological wholeness. Oram's theory of self-care deficit describes how people can be helped through nursing. Oram identified 5 methods of helping: acting for and doing for others, guiding and directing, providing physical or psychological support, providing an environment promoting personal development, and teaching. According to the scenario, the client, due to his illness, he can no longer perform his self-care needs, including his ADLs. He requires total nursing assistance to perform his daily activity. In order the nurse to help the client, she needs to follow the nursing process path as Oram theory suggested. The nursing process such as assessment, nursing diagnosis, nursing evaluation, nurse implementation, and nurse intervention. Based on the assessment data, the major nursing diagnosis for this patient may include the following: impaired physical mobility related to loss of balance and coordination and brain injury, self-care deficit, risk for impaired skin integrity, impaired swallowing, interrupted family process related to catastrophic illness and caregiving burden, acute pain related to hemiplegia and disuse of left hand and left arm, nursing risk for unstable blood glucose, knowledge deficit about diabetes type 2 and stroke, risk for infection. According to the nursing diagnosis, the client's nursing goals will be to improve his mobility, to improve skin integrity, to restore family function, to prevent shoulder pain, to stabilize blood glucose, to reduce risk for infection, to balance food intake with physical activity, and nursing evaluation. After the calls, the patient's evaluation will be the following. Expected patient outcome may include the following: improved mobility with minimal assistance, absence of shoulder pain, self-care achieved or moderate assistance from nursing, relief of sensory and perceptual deprivation, prevention of aspiration, continence of bowel and bladder, improved thought process, achieved form of communication, maintained skin integrity, blood sugar levels stabilized, restored family functions. In conclusion, nurses play a very critical role in supporting and promoting independence in patient care. Allowing the patient to be independent in their self-care and assisting when patients are unable to perform tasks will create positive patient outcome and is in the basis behind Orem's self-care deficit theory. The utilization of Orem's theory in nursing increases the recognition of nursing as a disciplined and rewarding profession. Orem's philosophy. It's believed that Orem's theory portrays the idea that nursing is the ability to care for another, especially when they are unable to care for themselves. This corresponds to our philosophy of caring for persons with the goal of achieving optimal level of health and wellness. Approach to Orem's theory remains consistent. Many clinical studies have shown that implementing Orem's theory has a positive effect on patients, nurses, and healthcare organizations. Thank you.